Hello everyone, greetings of the day. I am Geet from Beautiful Spotless Skin Team. I am sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to the study conducted across Indian cities reveal that more than 80% of the population present skin color heterogeneity on their face, irrespective of the age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone more susceptibility to pigmentary disorders. It occurs mainly in women, 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue very easily. This can lead to frustrating setback in the treatment. To avoid all the hassles and to keep you informed, today we are here to know about the management of melasma from an expert, who is Dr. Charan from Chennai. Dr. Charan is a distinguished cosmetic surgeon, brings a wealth of expertise and experience to his practice. With a background in plastic surgery from Madras Medical College and general surgery from Annamalai University, Dr. Charan has honed his skill through prestigious fellowships in cosmetic surgery, notably at Belgium and Apollo Cosmetic Spectra. His repertoire of surgical procedures includes hair transplantation, breast augmentation, tummy tuck plasty, rhinoplasty, and even gender change procedures, complemented by non surgical treatments such as fillers, Botox, and various laser therapies. A prolific researcher and avid participant in workshops, training programs, and Dr. Charan is committed to advancing the field of cosmetic surgery while delivering exceptional care to his patients. Dr. Charan is also a published author with contributions to esteemed journals in the field of plastic and reconstructive surgery. His dedication to continuous learning is evidenced by his active participation in the workshops and observer programs, ensuring he remains at the forefront of advancement in the cosmetic surgery. Today, we are privileged to have him with us, and he will be sharing insights on melasma and its management. We extend our heartfelt gratitude to you, sir.
Thank
Thank
you
you
so
so
much
much,
for
Doctor,
having
for
me.
joining us.
Thank you so much for having me. Yes,
And sir, such an important topic today to discuss melasma. And in the dynamic, overspeeding, changing world, I guess melasma is one common skin condition that everybody should be aware of. So I would welcome you on board, and I would like to kickstart the session by asking you what exactly is melasma.
right. So, like as you have rightly pointed out, melasma is a very, very growing concern, and especially among women around 20 to 40 years of age, basically, because it affects 90% of women and 10%. But nowadays, I have many patients who come in, male patients who come in with melasma. So, like, what is melasma? Melasma is basically a symmetrical, patchy brown spots. It can be a small spot, it can be a bigger one with areas of normal skin. So, uh, people come with small, small freckles, small, small dots over the face, and they're concerned it might be melasma. Yes, small, small freckles can also be a part of melasma, but it's usually a hyperpigmented disorder, basically. Yes.
Okay, so you mentioned it is more in females, and usually I said it in my introduction also that 80% of the women has it. So, what
Yes.
is the core reason? What do you think? Why this is on only to women more? Is it due to the sun exposure, or how is it caused?
So usually, see, melasma also has another name. It's called mask of pregnancy. So
Okay.
basically, pregnant women are more prone, but recent studies have discounted pregnancy being the most commonest trigger. But we see a lot of hormonal changes during pregnancy, especially with the luteinizing hormone, estrogen, progesterone surges. So with pregnancy, you see a lot of these brown, it's like periodical melasma comes and goes away on its own. And the most commonest trigger, there are four main triggers. The most commonest here being the sun exposure, UVA, UVB light. But we are also now more aware of the fact that visible light, that is LED screens, like visible light spectrums, can also induce melasma. Okay. The other main thing is intense heat. So somebody who's exposed to tanning, like, who's gone into tanning, who does a lot of steams, sauna, who works in all these chefs, kitchens, and all that, though they are also very prone for melasma. And it can also be a genetic disorder, like it families can have it, twins, one twin has it, the other twin can have it. Females, it's more female predominant, so females with mother has it, the daughter has it. So usually it can also happen in females. And also it's also a symptom of certain diseases like thyroid disease. It is a symptom of a thyroid disease. So suddenly one patch comes on your face, and then it can be also the first symptom of a thyroid, autoimmune thyroid disease. It can be as hypothyroid. You just have to check it out. And sometimes when you use some drugs, so cosmetics, some cosmetics will irritate your skin. Some drugs, like some anti-seizure medications, can also lead to hyperpigmentation and melasma. So these are the most commonest triggers of melasma. Sun exposure being the forefront, because almost 100% of the people are exposed to the sun.
Right, so 100% because on a day-to-day basis, everybody in a
Right.
general living goes out, travels a lot, and this might be the case of the sun exposure thing. But often there is a misconceived notion about hyperpigmentation and melasma together. So can you please tell us the difference between both of them? Are they the same thing, or is there any differentiation between both of them?
Yeah. So melasma is hyperpigmentation, but all hyperpigmented patches are not melasma.
Okay.
Okay. So melasma is a hyperpigmented disorder. It is characterized, for example, let's say you have spots all over the face. Suddenly your face becomes dark in color. So you come and say that I have a hyperpigmented disorder, or a continuous symmetric darkening in the eyebrows. So suddenly one part of your arm becomes, suddenly hyperpigmented. So those are areas where you can call them hyperpigmented. For typically in melasma, you will have a patch, normal skin patch,
Okay.
usually face centrofacial, usually around the face, forehead, chin, upper lip, malar region, that's the cheeks, under eyebrows. So, but you will also see some areas of normal skin in between. Okay, so and it is a chronic disorder. Sudden appearance of some patches might be due to some allergy. It can be other causes also, but usually the melasma means it's a chronic disorder basically.
Sir, as we are speaking about it being a chronic disorder and chronic skin condition, so people usually in summers or in general any other season, people might misconceive this as just tanning or just pigmentation. So, what are the specific signs to it?
See, yeah. So, like you have said, in summer, okay, melasma is more common in summer. Okay,
Yeah,
suddenly more people will start coming in summer, and it's more common among the darker skin individuals, where the skin scale is around 4 to 6. It's much more commoner than in fair skin people, because it's a very common misconception that darker skin people will not get tanned, so we will not get melasma. But
right.
typically melasma is more commonly seen in our skin. Basically, Indian skin, Asian skin is very, very common, very, very prone for melasma. And in summer, we see a lot of these melasma is because a lot of us will not know the importance of sun protection. So the
Right.
sun damage is higher. Any response to the, any stimuli, the skin will start producing more of your pigment. And when this pigment is, melanin is the pigment which I'm talking about. When this melanogenesis and increase in the number of melanocytes happen, it can be due to any of the triggers which I've mentioned before, and it happens typically during the summer because a lot of us do not know the importance of a sunscreen. So
Yeah.
it usually comes as a flat patch, it is not raised, and like I said, it can be a symmetrical patch. Usually one patch on one side of the skin usually will not be melasma. It has to be symmetrical on both sides, and it has to have a intervening layer of normal skin. So these are the some factors by which we can identify melasma. Right.
Sir, is it more common these days in summer? Is it due to the weather also? It is seasonal?
Yes, yes. Because see, when we have a lot of sun exposure and when the temperatures are nearing 50 degrees, so there is so much of trigger on the skin. The skin is exposed to a lot of this pollution, stress, heat. Like I said, heat is has been studied a lot extensively now. So what happens is when heat happens, there's a lot of these, vessels, blood vessels in
Right.
the face, which start getting, spread, which start spreading out. So these
Right.
vascular endothelial growth factors become migratory, and they also take more amount of pigment, which also promotes the formation of melasma. That factor has been very recently studied. So drugs which are reducing the vascular part of melasma has also like slowly started coming out basically. But the intense heat, like not only the light but also the heat alone, will also start that it will also stimulate the skin to produce more melanin. It can be
Okay.
more melanin in the form of number of melanocytes, or it can be increased in the melanin content. It can be either of those.
So, sir, what is the main reason that the Asian skin tone or the Indian skin tone is more, inclined towards it rather than the fairer people?
Because we
Because
have
of the
more
color.
amount of, yeah, no, we have more amount of melanin pigment with us, and
Yes.
we are more predisposed to producing more melanin in response to any stress.
Right.
Naturally, the fairer skin people 1 to 3 are not very predisposed to having much like significant amounts of melanin in the skin. So when we have taken a study and we have found out that the Asian skin and the fairer European skin, we see a lot more melanocytes which are present, and lot more predisposition to produce melanocytes in response to any stress.
Right. Sir, as we spoke about the causes of it, I would ask you what we can do to prevent melasma and not get contacted by it.
Right. So if there is one thing that you take home from today is that sun exposure has to be prevented. UVA, UVB, visible light, and infrared. And so all of this can be prevented by using a well-rounded sunscreen. Sunscreen,
Yes.
sunscreen, sunscreen, basically. And also sometimes you also have to look at your drugs. Sometimes it can be part of your OCPs, your contraceptive pills. Sometimes it can be part of your stress, your lifestyle, because now, as you spoke, it's a very fast-paced lifestyle. There's so much of stress, so much of
Correct.
pollution. So we have to take all these de-stressing maneuvers, because I have had patients who come in and say, I'm using good amount of sunscreen, I'm having all, I don't take OCPs, still I'm having these patches. But the factor, the amount, the stress causes melanin pigmentation has been discounted, because not much has been spoken about the effect of stress on the human body, especially on the skin. But stress is also one of the major factors which can start leading to melasma. So de-stressing maneuvers like yoga, meditation also will play a role. Lifestyle modifications, all of these will play a role in this. So these are a few factors, few things which you can start incorporating in our daily lifestyle, so that we also stay protected against melasma. Because like I said, it's a chronic disorder, and I said it's not, there is no permanent cure basically. And we can only keep on applying something on the face, or we can take something orally to prevent the widespread pigmentation of the face. And it leads to a lot of depressive disorders. It leads to loss of, like, avoidance of social factors, depression. So all of this can be prevented at an early age if we start using just one sunscreen. Will help reduce melasma formation by literally 70%.
Right. Sir, as we speak, nowadays sunscreen is definitely must, as well as sunscreen should be used in all season, I believe. And what do you think? What is the formulation of the sunscreen which we should use, which will help us not to go out in the sun and just contact any tanning, pigmentation, hyperpigmentation, or even melasma? What is the right broad spectrum sunscreen which should everybody should be easily aware of?
See, now we have SPF 50, we have SPF 30, we have SPF 80, we have
Right.
SPF 80 plus. So the factor is, here we have to go look for a sunscreen which protects against UVA, UVB. Some sunscreens also have to protect against blue light. Okay, so
Okay.
sunscreens which contain iron oxide will protect against tinted sunscreens. Basically, will contain iron oxide. Those will give you a good amount of protection against UV light, because we are all exposed to LED screens. We are all exposed to mobile phones. We are all exposed to TVs.
Right.
So blue light exposure is becoming an increasing concern now. So we'll also have to take that into account. And also something which can protect against IR. Some sunscreens also have an IR rating, but essentially a UVA, UVB, and a visible spectrum, a tinted sunscreen with iron oxide should be good enough. I would prefer, if you already have brown patches, if you already have some skin disorder, SPF 50 is the way to go. Otherwise, if you're just starting out, if your skin is okay, SPF 30 should be okay. But I recommend SPF 50 for most of my patients after any treatment or any disorder, skin tanning is there or any of these disorders you have, then you need to go minimum with an SPF 50. But most important about sunscreen is not just how much you apply, but also when you apply it. You can't just apply sunscreen on your face and just walk out. You have to
Yeah,
just let it absorb into your skin, because a lot of these patients say, I'm applying sunscreen for 6 months, 1 year. I just ask them, how do you apply your sunscreen? Yeah, I take my breakfast and then I just put some sunscreen on the face and I just walk out. You need
correct.
to give it time to get absorbed and to get activated. So ideally 15 to 30 minutes before 8 to 8:30 in the morning is the ideal time, because from 8:30 till around 6 in the evening, you have all the damaging radiations which come and can destroy your skin
Correct.
barrier.
Correct.
So before that, if you can start applying a sunscreen, it should be great. And also whenever you step out in the afternoon sun, let's say 1:30, 2 o'clock, you have to step out, you have to wash your face again, dry it, and then reapply the sunscreen and then go. Give it at least 15 minutes before you walk out, so that it gets activated and gives you the adequate protection that it deserves to. And also, I will also recommend using a hat or an
Yeah,
umbrella, where we can have a protection, like a physical protection.
yeah, or
We
a
all
cloth
have
cover maybe.
anything is fine, but the importance of these have been, like, have not been spoken about much, but these also help you literally in reducing the sun exposure by 20-30%, which is a lot. Right.
Definitely. Just keeping your skin very protected against sun, because these days, especially in the Middle East, doctor, there is a lot of sun exposure everybody is
Yes.
going through, I guess. And the sun is directly up our head whenever we are
Yes.
stepping out. It is almost the temperature is rising even and half. So definitely the primitive thing would be cover your skin and take good care, which will
Yes.
not lead to melasma in general. But what are the risk factors of melasma? Would be my next question to you.
So, risk factors would be any drugs you take for OCPs, like any oral contraceptive pills, any estrogen pills, like some nowadays pre-menopause, like when you're nearing menopause, we also start, complementing them on estrogen. So that can cause, estrogen. And sometimes something which can cause allergy on your skin, some product which you're using on the face, frequently causing some eruptions. And finally, which will lead to hyperpigmented, can trigger melasma. And sometimes your thyroid medications, sometimes, like, actually thyroid medications can cure and also can cause melasma. Sometimes your seizure medications can cause, you have fits and you are taking some medication, it can also cause melasma. And usually pregnancy is, was said to be the most commonest factor, but now pregnancy, the role of pregnancy has reduced. But because in pregnancy we are undergoing a lot more stress and we are exposed to a lot more light and outdoor exposure, so that is also accounted for the prevalence of melasma in pregnant women most commonly, right?
And sir, how do you generally diagnose melasma by by the symptoms you told us, skin patches or the color, or there are any different things to diagnose melasma?
See, we usually can use a wood lamp, very primitive method of using it. We can use a dermoscopy. We can use a confocal microscope to see whether you can see up till the epidermis or dermis. You can see where the pigment is there, and you can see also by clinical examination. See, you have to just visit a dermatologist or a skin specialist to find out if actually the patch is a melasma or it is actually something else. So if it is a raised patch, melasma never is a raised patch. If it's a flat flush to the skin patch, then we can, okay, it might be melasma. It can also be some other symptom of an underlying disease. So you can start diagnosing, you can do a thyroid test, you can rule out your thyroid disorders by that. And sometimes suddenly melasma starts when you start taking some medication, when you start applying something on your face, some food which you start taking, some allergies are there. So all of this can help you in diagnose, but typically in the outpatient setup, we can use a dermoscopy, a confocal retinal microscope, and also sometimes a wood lamp also. Yes.
Sir, the melasma transfers due to family history also? Like if the mother has it or the father
Yes.
has it, is it possible that the child would
Yes,
develop
there
it?
is a genetic predisposition, so that basically in your genes there is some amount of increased level of melanogenesis which is already being programmed. So the only thing is, like, it might be programmed for all of us. It might you
Okay.
we might all have the trigger, like the inheritance of melasma, but only factor is whether we are allowing any trigger to activate it or not. So if you don't
Right.
activate the trigger, then half of the people will never get melasma. Or
Okay.
like if somebody activates it, people will come and say, my mother has it, my sister does not have it, but I have it.
Right.
So it all depends on whether something is activating that factor which is already present inside your DNA, basically. So avoidance of stress factors is very, very important.
Okay. So, sir, while we are on the subject, also one of our viewers asked the same question, that what role does genetics play in the development of
See, usually
melasma?
when there is a female child with a mother or a mother maternal side, there has been a history of melasma. The female child is more predisposed to melasma because by, like you said, 90% is only women. So 90% there are more chances of developing melasma is there. So only thing is we just have to be more careful. It's not because melasma is not going to lead to anything serious, but it is a serious disorder which can lead to other symptoms like depression and avoidance of social life and everything. So all that self-conscious behavior will happen. So we just have to be okay. So my mother has it, so I have to be more careful with my sun protection and to prevent all these triggers to start triggering a melasma episode. That's all.
So, doctor, like many myths are there around us. So, one of the common myths is also that melasma can turn into cancer. So, is it a
Definitely
possibility?
not. Definitely not. Melasma is never a symptom of cancer. Melasma can never turn to a cancer.
It is just a skin condition which definitely needs to be taken care of in time.
Yes, see, the point is, it is also because it's a skin condition, and usually it's a skin condition which is harmless, basically.
Right.
But when you go meet 10 people and nine of them keep asking you, what's that black patch on your face? What's that black patch on your cheek? What's that black patch on your forehead? You start becoming self conscious of yourself. And the 10 becomes 100, you become depressed completely. You will sit down, you will start obsessing over that black patch on your face. So
Yeah.
basically, since we are a very social, humans are social animals, we have to interact with other people. So that makes it very, very important for us to treat melasma very seriously.
So, sir, while we are at the treatment of it, as a professional, I would ask you, how do you treat melasma?
See, melasma, like I said, the trigger is also multifactorial. Treatment will also be multifactorial. So we have like variety of treatments for melasma. So it has to be a combination of treatment. No, there is no one go like magic Midas touch where I give you this cream, it works, and then there is no melasma. First of all, even before that, I'll put a disclaimer saying that if you are thinking I have a black patch, I have melasma on my skin, and now sir is going to say something that's going to make it completely vanish and my skin is going to become like before, it's not going to happen. Okay, where we are only working on to reduce the intensity of the patch there. And while there might be 30% of people who might have complete vanishing of these patches, 70% will have some amount of reduction in the pigmentation where we can camouflage it with professional makeup. But it has to be a multifactorial and it's a long drawn treatment. There's no short duration, and it has to be strictly adherence to the protocols, basically. So you can't just apply cream on one day, not apply the next day. You can't apply not apply sunscreen and come and say I applied this cream, nothing worked. Okay, basically it has to be multiple things. And first, there are two main things there in treatment. One is prevention of sun exposure. Two is skin tone, evening of the skin tone, basically. So when you avoid the triggers, when you identify the melasma and you've identified the trigger of melasma, let's say you're taking OCPs and you have melasma. The melasma should typically get better if you stop OCP and switch to another mode of contraception. And if you're taking some other medication for some other medical illness which you cannot switch over, then you will have to be on long term topical application so that to keep it under control, basically. As long as you're going to take medication for it, which is going to stimulate melasma, you can't expect the melasma to go away completely. Second thing is, if sun exposure, UVA UVB exposure is the main cause, then without a sunscreen nothing works. You can't keep applying something on your skin and not use sunscreen, because the first thing, every patient comes into my clinic, the first thing I say, please use a face wash and a sunscreen. That's the first, line of skin treatment that you have to do. Everybody has to follow. It's universal. So the thing is, if you cannot adhere to that, then there is no treating melasma here. So
So, sir,
basically stopping. Yes.
the basic thing is definitely, as you were saying, to apply the sunscreen and definitely whenever go out in the sun to be very
Yes.
prepared about the sun rays.
Right. So, and there is another thing, like, so the gold standard here is a hydroquinone triple therapy. So, triple therapy means we have hydroquinone, we have a tetinoin, and we have a steroid. Usually, all these therapies are all targeted at 2 months to 3 months regular usage. Once or twice a day it can be used. And now there are now newer things have also come. We have chemical peels for treatment. We have oral tranexamic tablets which can help you, oral pycnogenol which can help you. But it's all tailor made to each person. Let's say, but oral tranexamic acid, we have tablets where those tablets which are used for preventing bleeding. And we have found out that those tablets can also cause skin whitening. So, uh, 250 milligram twice a day for 4 months, 2 to 4 months, can give you a drastic improvement, in addition to using a sun protection and also a triple combination or a topical cream. Kojic acid can help you, azelaic acid can help you, arbutin can help you. Typically, hydroquinone is the gold standard, and even a plain steroid cream followed by a hydroquinone can also help you. But all of this has to be in combination. And if you want a faster resolution, if you have other skin conditions in addition to it, let's say you have wrinkles, you have fine lines, you have pores, you have acne scars, then other treatments like chemical peels come into play, where we have retinoid peels, you have TCA peels, you have glycolic acid peels, which can also help you. But all of these have to be done in multiple sessions. Not in a single session will not going to like completely give you a miracle, a cure. And also micro needling with PRP can also give you some amount of skin whitening. Recently we have found out oral glutathione can also increase your, like, decrease the severity of melasma and also improve skin brightening by quite a lot, by around 40% at around 2 to 3 months. All of these are long term, since all my treatments will not be take it for 2 days, take it for 3 days. We'll have to continue it for a long term. And it is, since it's a chronic disorder, it takes 3 months or 6 months or 3 years for 5 years to develop. You also need to dedicate that much of time for it to go away also. Sometimes it vanishes miraculously, sometimes some amount of residual remnants is always there, which means our ongoing skincare is very, very important.
So, sir, as you mentioned, as it like the skin condition can be prolonged and even be for 3 months to 6 months. Definitely, as we spoke about the multiple treatments, and due to technology and science, there are various treatments which can definitely be helpful to all our patients to solve this problem easily. But sir, multiple questions pops up in my head that it is only on the face or we see it anywhere on the skin, or the most common thing is on the face.
See, most commonly is on the face, forehead, chin, upper lip. Sometimes
Okay.
it can also come on the arms, the chest, neck.
Okay. All right. So that whenever in general we speak to our relatives or a friend and we tell them that this is the conditions, as we spoke about man being a social animal, generally we speak a lot about our
Mm.
skin issues. So natural remedies does come into picture in that case. Should we use any kind of over-the-counter solutions or any remedies, or we should directly uh, contact our doctor for any such
I
symptoms?
Okay. I would recommend you to go to a skin specialist first. You can
Yeah.
also use your over the counter also, because so many people think it's just a superficial pigment and more scrubbing of the skin. Let me use a scrubber and then keep scrubbing. But in
Yeah.
reality, what happens is, when you keep scrubbing the skin, when you expose the skin to more stress, you're only stimulating the skin to produce more melanin. In reality, it is only going to become more darker. It's never going to become light. That's why a lot of these people with underarm pigmentation, they come, they use a lot of these abrasive gels, skin removal creams, and sometimes they use a lot of these scrubbers, use citric acid, use lemon, all of these things. All of that will irritate the skin, sometimes cause allergies, and all of that will only stimulate the skin to produce more melanin in that area. So we'll have to be very gentle in treating melasma. We can't just take, okay, it's a superficial pigment, let's just peel off the skin completely. So there is some amount of carotenoids which are seen in most of the fruits. Some amount of fruit like some lightening agents which are also seen naturally. They also help. But the only thing here is we'll have to see how pure they are. Okay, you can't just now take a turmeric stick and then keep rubbing on your face and say I used only turmeric, because the
Correct.
problem is you might use a turmeric but you don't know what germs or what infection or what allergy or what insect is there in the turmeric. You
Yeah.
because recently I've had few patients who have come say I only use tulsi, I only use turmeric which I grow in my garden. Understand, it's a completely natural, you use it organically. But you have you seen checked it for any insects there? Have you boiled the turmeric? Have you put the tulsi or whatever leaves you take in boiling water and then crush it and then apply it on your skin? Because we
Right.
think our garden is very very pure and there is no insects anything, and we think just taking anything on the plant. Some people take aloe vera there, break it and put it on the face
Correct.
because
Yeah.
for any allergies. All of that is happen. But what happens is that might trigger an allergy. That allergy might trigger a hyperpigmentation. That hyperpigmentation might trigger melasma. So since it's a complex mechanism which is behind all of this, I would recommend you to first go ahead and see a dermatologist, because once a skin specialist says it's melasma, and if it is going to go away or by itself by using a few treatments, then it's better that we don't complicate it by kind of making it worse first and then coming to us after like 2 3 years of home remedies and then finally coming to the last stage, because there are certain forms of melasma which cannot be treated,
Yeah.
which will not be responsive. So anytime the pigment goes into your dermis, so skin has a epidermis, a superficial layer, and a deeper layer. Anytime the pigment is more present in the deeper layers of the dermis, it is very very hard to treat, extremely
Okay.
hard to treat, where then the treatments become more and more expensive, where we'll have to go ahead with deeper resurfacing, we'll have to go ahead with lasers, where the treatment cost starts shooting up basically. Because I don't want patients to spend a fortune on this, and only because it is going to come back, sometime, and they're going to stop the treatment. So usually post menopausal, sometime later, once the hormones are all under control, usually melasma becomes okay, better. It becomes tolerable. Sometimes you take some drug, you stop the drug, it goes away on its own. For that, you don't need to spend a fortune, and you don't need to be a Google doctor basically. So you just have to come, because there are people who studied like 15, 17 years for this. So they will know better about your skin, and we only mean the best for you. So it's better you
Correct.
visit a skin specialist so that you don't worsen your problem and come to us in the last stage where we can only say this only will work, and we'll have to spend a fortune on it. And then everybody has this myth that all skin treatments are expensive. We can
Yes.
start at 50 rupees, and it can go ahead to 50,000 or 5 lakhs also. But the thing is, it depends on which kind of a skin condition you have basically.
Yeah. So definitely, sir, people also have this notion of all the skincare products and skin treatments in generally are very expensive. So
Right.
that is why most of the people generally are afraid of going to a dermat first, going to a cosmetologist first. But I think any skin condition could make better, be at a better state by just visiting the doctor, and the half of the problem then is solved.
Yeah, I would like to share one very interesting thing, because sometime I think a couple of weeks back, one young girl turned up at my clinic, and then I was just asking her, she was having issues with her tanning. And then I was asking, so what did you do? Have you tried any skin treatments? Because the initial consultation. It's like, yeah, I wanted to apply a sunscreen, but somebody online said, no, don't apply sunscreen. It's very bad for your skin. Sunscreen will
Oh,
darken your skin. That's the first time somebody's ever told me this, in the entire professional life. I'm the first time I'm hearing it. So there are so many things which are circulating around. I was just shocked. So basically, like, because the basic thing that we keep on telling everybody, even from at 14 15 years of age to like 40 50 years of age, will say please use a sunscreen, please use a sunscreen, please use a sunscreen. So many myths are all circulating around. So the thing is, it's better you visit someone who's got a very in-depth knowledge about it, so that it's easier for you and easier for us to treat melasma also.
correct. So, sir, which brings us to our next question, that is melasma due to some allergy or infection, which already you spoke about, that it definitely is a side effect or allergy
Yes,
if we
it
do not.
can be. It can also trigger. Melasma can also, it is usually not an infective disease. You cannot spread melasma, but it can some allergies which are doing over a period of time. Let's say you have a very favorite skin brand product, and you put it on there and you get small small eruptions, but you don't mind it because you really like the product and you really like the way after the skin is there. You keep using it for 2 months or 3 months, the small eruptions, the small allergy which your skin is there, that might trigger an increased melanin response and might trigger a melasma. So you'll have to be very careful on what products you use also and what you eat also. Sometimes food allergies. Let's say you like palgova. Let's say you like gulab jamun. You keep eating gulab jamun, so you will have eruptions on your face. But usually we ignore it because we really love gulab jamun. So what happens is regular eating of that over a period of time, 3 months or 6 months, some suddenly lead to a patch which we not know because we will never really find out it's your gulab jamun which caused your melasma or not. So you will have to be very careful if you want beautiful skin. You'll have to be very careful on what you put inside and what you put on the skin, because what you eat is around 60% of what your skin is, and what you put it makes around 40%. Whatever treatments we give is around only 40%. Rest of it, if you keep eating pizzas, burgers, fried foods, all sweets and everything, your skin is never going to become glowing.
Definitely. So, sir, there are multiple balanced diet options, and
Yes,
definitely the dietary solutions, I think, reflects on the face, and even water, like the
yes,
hydration
definitely,
is
100%.
plays a vital role in so sir, one prominent question which comes in everybody's mind, I think, that can melasma be permanently cured or disappeared when taking a right course of medicine or treatment? Sir, we cannot hear you. I guess there is a glitch problem. So, as we were speaking about melasma being permanently cured, and I hope this is some common myth, common notion, common thing which we all have in mind. Definitely, when it comes to skin, everybody is afraid, everybody is stressed about when this thing will be disappear, when we will be able to go out and meet other patients. But definitely, doctor will help us in knowing this better. That can melasma be entirely disappeared in future? Can't hear you. I guess the doctor will be able to join us very
Is it
soon.
better now? Can you hear me
Yeah,
now?
sir, can hear you better now.
Yes. Right. So basically, melasma, if you're one of those 30% of the blessed population, like I spoke about, yes, melasma can completely go away. But 70% of the people, you can only control it. You can only keep it under control. So we'll have to keep doing some form of skin treatment or some form of skin, you have to keep pampering your skin with some kind of a product for a long period of time. But once you cross the age, once you go into that perimenopausal age, after you cross menopause, usually it subsides. Usually we
Okay.
see dramatic changes. And if it is due to some other stressor factor, it can be any of your drugs or it can be any pollution or stress. You take it away, it goes away. Okay. But if it's purely, typically a genetic melasma or something which is related to sun exposure, then it only goes away only if you keep using something on your skin and if you keep protecting your skin, basically.
Which definitely tells us that it is not a permanent condition. Definitely, it can be cured, but with the right treatment and the right taking care of the things around us.
Yes, yes.
Going back to our viewers and their questions, there are so many questions about melasma. Rohit from our viewers is asking, how does melasma affect different skin tones?
Usually around in the skin Patrick, the Fitzpatrick 4 and 6, it's more prevalent. 1 to 3, fair skinned individuals, it's recently we found even 2 and 3 are also more affected also. But skin tone 1 usually doesn't really get affected by melasma because the amount of melanin is really less basically compared to the other skin tones here.
Meaning that they are the lucky lot, I guess.
Yeah,
They
yeah,
are
that's
not.
a lucky lot, yes. But
Uh,
yeah, they are the lucky lot, but they are also more prone for other types of skin disorders like basal cell carcinomas and squamous cell carcinomas, whereas we are more protected against it.
yes, correct, 100%. So all the skin tones of after two, as doctor mentioned, please apply sunscreen in the sun and take good hydration and good care of yourself. Pooja Sharma from our viewers is asking, sir, what are the psychological impact of melasma on patients? Definitely, there are multiple mental stress, I think, which revolves around whenever we have the skin condition.
Right. Basically, right now we are a social media generation. We are there. We are in the social media generation where everybody, wherever you go, nobody can. You can even live without food and water, but you can't live without your mobile phone. Okay, and
Yes.
every one in, like at least 8 in 10 people are posting regular reels or videos regularly on Facebook or Instagram or some form of social media. They're very active. So what happens here is you keep seeing billions of people, like not even, you see a lot, tens and hundreds of millions of people, with glowing skin and everything. It usually gives you that whenever you see your mirror, you see your skin, you have a patch on your face. So what happens is it starts triggering self-doubt, self-consciousness, and then you start becoming more and more conscious of yourself. Whenever you talk to people, you tend to hide that side of the face. I've had patients where they take their hair and put it on one side of the face, so that side where there's a big patch where they'll be putting it on the face, and they'll tend to cover the foreheads and all. So all of that will lead to confident issues where you cannot express yourself, openly and very cleanly. Second thing is chronicity of this problem. Initially, it might be a self-conscious thing. Later on, it develops into a depressive disorder because everything you start relating to the fact that, I don't look good, so nothing works for me. Nothing in life works for me because I have the black patch on my face, which is typically not true. But your brain starts revolving around the fact that there is something wrong with me. That is why I have a patch on your face. That thought keeps recurring again and again and again. That leads to depression. And where I have had patients with suicidal thoughts also. Like this patch, when will it go away? I'm having suicide. Why should I live? So all of that comes from a very small thing of self doubt and self consciousness. So the importance of treatment of melasma can never be highlighted because it might look like it's a harmless patch, but it can trigger somebody to a suicide. Then we'll have to start taking it much more seriously.
Yeah, definitely. And any which ways, generally, we have to start taking our skin more seriously and just not treat the other things, but the skin better. Some
Yeah.
two of the repetitive questions are there, which we already discussed while we were discussing closely about the treatment, the preventions, and all the areas. I would just like to quickly address that so that our viewers know the answers of that. Akansha from the viewers is asking, can melasma develop in areas other than the face?
Yes, can develop in the neck, chest, arms. Yes, wherever sun exposed areas are there, it can develop.
Yes. And Yash from our viewers is asking, how does sun exposure impact melasma? Does it
Sun
triggers it, or just going out in the sun may cause it as a problem?
Yes. See, UVB radiation will trigger melanogenesis, increased melanocyte production, increase in the number of melanocytes, and increase the production. UV rays also increase the transfer of melanocytes to the skin, basically, to the epidermal layer. And the visible light is also found to, kind of stimulate more melanin production from the skin and also heat. So when you're going in the sun, we are exposed to all of these. We are exposed to UVA, we are exposed to UVB, we are exposed to visible light spectrum, and we are exposed to the heat, especially in summer. So when you're going unprotected in the sun, all four mechanisms will act against you and will trigger melanin production. So the thing is, one walk in the sun might not trigger it, but repeated activity, repeated walking in the sun, repeated exposure to sun without any protection will trigger melanin production. That is why we tan also, basically. Otherwise, we should never tan, simply.
Yes.
So we'll also have to think on that aspect where repetition of some activity will definitely trigger hyperpigmentation, and this hyperpigmentation over a period of time can definitely develop melasma, especially common in males who are also very very active in outdoor sports,
Yeah.
because
The
some
ones
of
who
the
travel a lot, outdoor exposure of the sun.
exposure is very very high. I see a lot of these in these sports people where people who are well informed use a sunscreen, get themselves protected, but other people don't use it because usually sunscreen is for girls, right? So no, men now they've started coming, to terms that sunscreen is just not for women; it's also for men also. It's actually a unisexual application. So now more and more men are also preferring to use sunscreen, where they are also becoming more and more conscious.
Definitely. So Pooja is asking the very interesting question which may help people deciding their diets. Are there any dietary factors that can worsen or otherwise like improve melasma? So
See,
any food products?
usually nothing worsens or improves melasma. Like I said, certain foods might trigger an allergy, which you have to avoid. Otherwise, you'll have to start having a balanced diet where you can eat skin-friendly foods. Let's say vitamin C rich foods, eggs, egg whites, vitamin D, milk. So all of these foods have to be in regular, in proper, amounts so that your skin becomes better. So, or when your skin is better, when you have a lot of water, like you mentioned, hydration is very, very important. And also whatever you apply on the skin, all of this together will create a balanced skin, also will also create a stable skin, which will prevent against melasma.
Okay. So our next question from the viewers, Neha, is what is the most effective treatment for melasma?
Gold standard is the triple combination where there is hydroquinone, tretinoin, and some form of a steroid. That's the gold standard with a sunscreen plus sunscreen. Yes, that's the gold standard which everybody uses in the beginning.
So what do you suggest, the oral medications help faster or the topical, or both goes hand in hand?
They go hand in hand. Oral medications can improve the efficacy of the topical medications also, but oral medications again cannot be given in pregnant women, cannot be given with people with thromboembolic disorders, like people with stroke, or like some people with thrombin disorders. So we'll have to be careful on who we give the oral medication to. You can't just take a pill and pop it in your mouth, because you might be prone for these thromboembolic disorders, which might lead to some form of a side effect, basically.
So before we wind up today's session, I hope it is very informative for our viewers, all the vital information shared by you today. But any take home message or any closing remarks, how to take care of your skin and how to prevent melasma in general to treat your skin condition better?
Right. So, my thing is, recently I read an article which made a very interesting remark, where there was a randomized control trial where they exposed people they had separated people into two groups. One group just used sunscreen SPF 50 regularly over a period of 30 to 60 days. The other group did not use any of these things. And both of the groups had melasma. They found out just simply using an SPF less than 20, SPF 20 over a period of 30 to 60 days, resulted in a reduction of the melasma by around 20 to 25%, just a sunscreen. So, any form of skin treatment is ineffective without a sunscreen. Sunscreen is the first line of defense against most of the stressing factors which will create melasma. Then comes the triple combination treatments, plus other treatments like azelaic acid, like the other arbutin and everything. Plus all of these together in combination with a chemical peel or a razor resurfacing will help you in keeping melasma under control, or even sometimes completely cure melasma in 30% of the cases. But first of all, you will also be very, very aware of the fact that if you are a male or if you are a female, you are equally prone to having melasma. 10%, you might be one of those 10% people who are prone to having melasma. So it is our imperative duty to keep ourselves protected, especially with temperatures reaching 50 to 52 degrees. We'll have to keep ourselves protected, and we'll have to protect our skin. So skin protection is the only take-home message. If anything, if you haven't followed anything else, please use a sunscreen. That's my only thing.
Definitely. The all I need sunscreen is a must whenever you step out of the houses. And
Definitely.
definitely vital information and sessions like this may help them, provoke them to definitely use a right set of sunscreen.
Definitely.
So thank you
Definitely.
so much, Dr. Charan, for your valuable time. And it has been a very, very informative session for all our lovely viewers. And it has been very great to hear from you. We look forward for many such sessions in the coming time. Thank you to the viewers also for today's excellent participation. And I would request all of you to stay connected to our beautiful, spotless skin page so that everybody's skin is shining, beautiful, and spotless. Thank you so much, Doctor, once again.
Thank you. Thank you so much for having me. Thank you.